Hey everyone, and welcome back to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled, What You Must Know About Flexor Tendon Injuries. If you've read my avocado cutting or hand injuries article, then you heard me talk about the dangers of slipping with a knife. Not that that's necessarily breaking news to anybody, but what you might not know are the specific consequences of slipping with a knife and cutting your palm. As in, what would you actually cut if that happened? And is that really that bad? You see, a slip of the blade that goes into the palm, or a palm side of the fingers, will almost always hit a flexor tendon, and often a nerve and artery, but let's save that for a different day. And not only that, if you're holding something with that hand, those flexor tendons are under tension as the knife strikes them, meaning they will snap in an instant. If that's not enough, I'm sorry to say that it gets even worse. But let's quickly talk anatomy so the rest of the discussion makes sense. So what's a flexor tendon? The flexor tendons are long white ropes that anchor to the tips of your fingers and when activated, bend the fingers down into a fist. They originate as muscles up in the forearm near the elbow and eventually taper down to these tendons that we use constantly. Think about gripping, pinching, typing, etc. From about the last 1/3 of your palm through near the tip of your finger, these tendons actually run inside a pulley system. For simplicity, think of this as one long tunnel through which the tendons slide. This pulley system is actually a series of bands, and the whole thing acts like the eyes on a fishing pole to keep the tendon as close to the bone as possible. This increases the force with which we can grip. The part of the flexor tendon that is inside the tunnel is called zone 2, as opposed to the parts of the flexor tendons in other locations, such as in the palm, wrist, or forearm. So why does the pulley system matter? Do you remember above when I said that it gets worse? Zone 2 flexor tendon injuries have the worst outcomes of any type of flexor tendon injury. And where do you think the majority of accidental knife slips end up? You guessed it, Zone 2. The only treatment for a flexor tendon injury of any zone is surgery to repair the cut ends back together. These will never just spontaneously heal on their own. When I surgically repair the tendon, I tie a series of knots with some fancy woven stitches to make it as strong as possible. But we're still talking millimeter thick suture here. Nothing that's crazy strong. So ultimately, the strength of the repair relies on the cut tendon ends scarring back together and forming a new biological bond. And that's all fine and dandy for zones 1, 3, 4, and 5. However, in zone 2, not only will those repaired tendon ends start scarring together, but they will also try to scar to the tunnel or the pulley system that surrounds them. And this is a recipe for stiffness, weakness, and just generally poor outcomes, but primarily permanent stiffness. What should I do about this? I hate to make this a like your mom always said sort of article, but like your mom always said, be super careful with knives and all sharp things, really. Don't slip with a screwdriver with your hand on the other side. Don't pit an avocado with your hand on the other side. Don't slip with a power saw with your hand on the other side. Or, for the musically inclined, my daughter broke out into song this week while cutting watermelon to the tune of Here We Go Round the Mulberry Bush, keeping my fingers above the blade, above the blade, above the blade, keeping my fingers above the blade while cutting watermelon. So what am I really saying? These are almost always life-changing, potentially devastating injuries. How functional would you be if you couldn't make a fist? It's not as simple as just sewing the ends back together. I see it too often, and it's always just sad. Don't get me wrong, I get plenty of great and excellent outcomes from these injuries. I am fortunate to work with incredibly talented hand therapists and motivated patients who get the job done. It just isn't a guarantee. And the best treatment of all is prevention in the first place. So some takeaways from today. Flexor tendon injuries are extremely common after slip of a knife injuries to the palm side of the hand. The worst injuries of all are to the zone 2 location of flexor tendons, and this is unfortunately usually directly in the path of most slips. The best treatment is prevention in the first place. It's worth the extra effort and time to slow down with those kitchen knives and avoid this injury at all costs. So the next time you're rushing to get dinner on the table and flying through chopping that onion as those inevitable tears drip down your face, pause for just a second and make sure you really know what you're doing. Save yourself that blink of an eye injury that could change your hand function for life. That's all for today. Thanks for being here. See you next time.